So this patient's coming in for a lesion that's been growing on the left side of his cheek for quite a while now. How long would you say that's been there for?
Oh, it's been there for quite a while.
Quite a while.
Yeah.
I'm working with Dr. Jane again. What do you think that might be, Dr. Jane?
Could be a basal cell carcinoma.
Yeah, so what type of carcinomas can we see with the skin?
So you have squamous cell,
Yeah.
basal cell,
Yeah,
and then melanoma.
yeah. There's also Merkel cell, which gets a bit more diffuse. Then you get things like cutaneous forms of other cancers, lymphomas, Kaposi sarcoma, that type of thing. But see this, the tissue looks pretty normal through here. I have a feeling this is more going to be like an irritated Seb-K more than anything else, but to your point, those differentials would still apply. And just keep in mind, those are all named after just the cell type. So there's 3 cell types of the epidermis, and that's the squamous cells, the basal cells, and the melanocytes, which is why the cancer's named like that. So this has been growing for a little time, so we froze underneath this and we'll clip this. He also has, if you just pan back here, you can see the top of his scalp. See these growths that are here. What are these, Dr. Jane?
Keratotic horns.
Yeah, so keratin horns, keratotic horns, cutaneous horns. The issue here is most of these are benign. 1/3 of them can sometimes be associated with precancerous changes. So this we would actually treat with liquid nitrogen treatments. If they get away in, sometimes radiation treatments, and he's having that done as well. You can't take that off in one fell swoop. It's a little bit too far gone for that. But this lesion we're going to take off and see how we do with things. So does that hurt at all there when I do that?
No, that's fine.
So he's been in my practice for how long now? How long have you been in my practice for now?
I think since you started.
So about 25 years now?
Yep, and I signed I signed a form. You were checking who you were going to take.
Yeah, the ministry had just checked that when we started.
And
yeah.
I started with you. He passed away.
Yeah, how long were you guys
myself.
married?
Oh,
Long
75
time,
years.
75 years, which is
Yeah.
pretty incredible. She's a wonderful lady.
And I had your brother look after her back, and he did a fine job. How's he doing?
Okay, he's doing well, actually.
Good.
That doesn't hurt when I squeeze there?
No. How is
He's good, actually.
he? Big boy now.
He is, actually. He's
Oh
tall.
my gosh. Is he going to be a chiropractor?
I'm not sure what he's going to do.
Yeah, your brother fixed my wife's back up with wonderful. She
That's good.